Welcome to the Holistic Wealth and Health Podcast. Your co-hosts, Jason Smith and Brian Bibbo, will inspire and teach you how to prosper in your mind, body, and spirit, not just your financial life. Joining forces with field experts, Jason and Brian are here to help you focus on what matters most in your life, living well.
Hello, this is Jason Smith, and I am here with a special guest today. He actually is my personal physician, and he's the head of wellness and preventative medicine. Did I say that right, Dr. Saper?
Absolutely correct.
All right, for the Cleveland Clinic. And I'd like to share just for a moment, for me, I've went through a lot of personal physicians through the years and never really been happy with one before, because I'm one that I believe in diet and exercise and stress reduction and vitamins and supplements and living a healthy lifestyle and basically just taking care of yourself, because I think the body is made to take care of itself, right? To heal itself. And too often, I always felt like every time I had something going on, I would leave the doctor's office with a pile of prescriptions and just things. And it was just like, man, I don't like taking a lot of pills. I like to let my own body heal itself. In many cases, that's what I would do. And it wasn't a great experience for me. I was never able to really develop a great relationship, but I have a fantastic relationship with you, Dr. Saper, and so much respect and appreciation. More recently, when I saw you, you even led me through a meditation exercise, and which was really helpful. And it's much more in line with the way I think and what I believe in. And so I wanted to have you on here today, and I'm really excited to have you here. Appreciate you being here.
Thank you so much, Jason. It really is an honor and pleasure to be able to speak with you in this context. So thank you.
And Dr. Saper, if you would, Cleveland Clinic, I think, is really a pioneer in the not just the country, but the world in many ways. Let's talk specifically about wellness, preventative, functional medicine. And what do these things even mean? What would your definition? I think people get confused sometimes. What is functional medicine? What is wellness? What is alternative medicine? These lingo can you give us some clarity on that?
I'm happy to. Terminology, words, they matter, right? Whether it be in healthcare or how we connect and converse with someone. So words really matter a lot. More than 25, 30 years ago, people spoke often about alternative medicine, acupuncture, meditation, Reiki, crystals, and so forth. That term, however, has evolved and changed. And what we refer to now as alternative medicine is any other treatment that a patient may use that's outside the realm of what's taught in medical school or what's usually practiced in medicine. And the way we use alternative medicine now is using an alternative therapy in lieu of a mainstream medicine. The more extreme example would be, and I saw this when I was early in practice, a patient with breast cancer, a very large breast cancer, pursuing, despite my attempt to persuade her otherwise, pursuing a magnetic mattress to treat the breast cancer as opposed to consultation with an oncologist and a surgeon. So alternative medicine, fortunately, in that way, is not too common. Really, most people are like yourself, Jason, that you're describing, where, hey, if you got to take a medicine or surgery, you got to do it, but you're also open to these other approaches to healing. So that's alternative medicine. I don't like to use that term too much anymore because I don't promote that. Wellness, on the other hand, I think is a really great term, because what wellness means is the active pursuit of physical, emotional, social, and even spiritual health and well-being. And framed that way, all of us have the opportunity to do that. Whether we're a totally healthy person, no diagnoses, no chronic illnesses, or someone who's had a stroke and in a wheelchair, all of us have that ability to pursue the optimal health within whatever limitations or disabilities we have. And that term as an approach to health and healing, I think really fits. And I think Cleveland Clinic, I agree with you. It's really ahead of its time. It created a Department of Wellness 20 years ago. So very proud to be able to lead our department here.
And how about functional medicine? How would you describe that, and what role or how does that fit in this realm?
Yeah. So our Department of Wellness and Preventive Medicine here at Cleveland Clinic, we have two clinical centers, we call them. We share space and so forth, but two centers. One center is what you're describing, the Center for Functional Medicine. Functional medicine as a discipline is on fire. People are really interested in it. There are books on it, podcasts, and so forth and so on. And the way I like to describe it is, think of ourselves, our human beings, right? What do we have going on with our body? We have a digestive system that's absorbing nutrients. We have a neurologic system that's communicating messages throughout. We have a system of energy production, the cells with the mitochondria that are producing energy for us to be able to do what we want and so forth. We have our immune system that fight infection. So these are all systems in our body. And for us to achieve optimal wellness, all those systems need to be functioning optimally. And it's a very different model, but complements beautiful with medicine. So typically in mainstream healthcare, and this is very helpful, we make a diagnosis. John has hypertension. Mr. Jones has type 2 diabetes. And these are diagnoses, and we have treatments for these diagnoses. And it's very helpful. It's a very helpful classification schema. Functional medicine treats all those same diagnoses, but in a different way. It steps back from the individual diagnosis and say, of all these systems, what are working well and what are not working well? What's in balance and what's in imbalance? And tries to treat and rebalance those individual systems. And what's exciting about it is when you can potentially rebalance and get those systems well, more than one diagnosis improves, right? The diabetes may improve, the high blood pressure may improve, you may lose weight, you may feel better, you have more energy and so forth. So it really tries to look at that whole person, which is an important aspect of the philosophy of everything we do here in wellness.
Yeah, they go hand in hand, but ultimately it's almost like functional medicine is under the umbrella of wellness.
100%. And that's why we have our center here of functional medicine. And we also have another center, we call it integrative and lifestyle medicine. And right off the bat, I'll tell you, there's a lot of overlap between the two. With a lifestyle medicine approach, which is, again, used often in functional, so there's a lot of overlap. We really look at some of the things you were talking about in your introduction. How are you sleeping? What's your physical activity like? How is stress impacting you and how are you managing the stress? What are you consuming, both foods and drinks? What is your sense of social connection, whether it's in the family, extended family, community, and so forth? And then going even one step further, and we often may not get to this because people are struggling with so many very immediate issues, but ultimately, what are we doing here on the planet? What's our meaning? What's our purpose? And what I'd like to say to patients is health and wellness in and of itself is obviously a good thing. It's nice. It's a good thing. We all aspire to it. But ultimately, why do we need to be well? Why do we need to be healthy? And that's where I think it takes to this other level so that we can make a difference in the world. And maybe the difference is with our own children and
Right.
raising them beautifully. And maybe our difference is introducing some legislation at the state level that can impact thousands of people.
Yeah. And I think it's so much about what you're describing. It's a lot of blue zone lingo, right? And
100%.
I read books and watched documentaries. I'm a big fan of that. And it's everything you're describing. And one of the important things is having a sense of purpose, which is exactly what you're saying. And I've been working with people, helping them retire for, it's been since 1995, right? So going on 30 years, it's hard to believe. And fortunately, I've learned some unbelievable lessons of what to do and been able to mirror a lot of the very successful people that have been able to create a great life for themselves, both personally and professionally, and for their families and financially and their health. And I've also seen the opposite. And I've seen too often where people go to retire and that was their social network, that was their sense of purpose. And then they go to retire and they don't have that sense of purpose anymore. And they start sitting around watching too much TV and they don't keep in contact with the friends they used to have. And then all of a sudden their health nosedives. And then ultimately longevity is affected. They could have lived a lot longer if they would have kept working than if they would have thought they had this golden years of retirement that ended up being really sitting on the couch and losing their way a bit.
You are so right on target, Jason. And you're making me reflect on some of the parallels between your profession and mine. I try to look at that whole person and beyond the whole person, their family, meaning, purpose, network, and again, health and wellness for the purpose of making a difference. And as I'm thinking and listening to you, and I am no financial planner, but have great respect for them and have one, is a good financial planner looks at that whole person and family and what are your goals and what do you want to do and how to bring about meaning. And wealth for wealth's sake only can go so far, I suspect, but wealth to make a difference. And then lastly, I've seen this many times, Jason, this scenario of often a man compared to a woman, but retiring and a decline both physically and mentally. And I think just like you're preparing people financially for retirement, as a physician, I'm talking to people in their 50s and 60s and 70s about also preparing for retirement, but not financially. It's what are you going to be doing? How are you going to be keeping healthy and having purpose? So it's very interesting.
And it's funny because what you're talking about right now is something that I did learn after seeing it for 10, 15 years. So now the last 15, 20 years, one of the biggest things that I focus on in my conversations for people to help them prepare for retirement is what are you going to do in retirement? What hobbies do you have right now? What goals? And just digging that out of them and getting them really thinking about that as a priority of how they're going to keep intact a sense of purpose and belonging to a community. And just those things are so important to prepare yourself for as you're considering retiring.
So true. And I think another common thread that you're getting at is, as a physician, I don't tell people what to do. Maybe 1 out of 100, if someone has a fever and a tenderness in their right lower belly, and I think it's appendicitis, I say, go to the ER, but that's 1% or less. The vast majority is a conversation, and I would even say a coaching, asking the person to self-reflect on what's important to them. And in the case of healthcare, do you prefer medications? Do you prefer a more natural approach? What are your goals in terms of your health? How important is longevity, but not just living long, but how important is the quality of life as you live long? And that helps me provide better guidance if I know where the person's coming from. And there's an emerging profession of coaching, right? Life coaching, health coaching, and so forth. And that is part of what we also do here, certainly in wellness, is helping the individual patient better understand what they want in their health and health care. And when you can create that relationship between, in my case, doctor and patient, so much more can occur. And folks feel more satisfied because I think I was reflecting on what you were saying, and thank you so much. And it's an honor to be your physician. But what makes a person feel positive about that? I think at the end of the day, it's that they feel heard, whether they want more medicine or less medicine, but they feel heard and understood, and that I'm with them on that path because everyone is different. And so what works for you may not work for the next person. And so that ability to be versatile, I think, is important. but to connect and let someone know that we're with them on this journey, not leading them on the journey.
That's well said. As you were talking a little bit ago, it made me think about when you talked about how this might be suggested from a wellness approach. And then all of a sudden, and it was to address one issue, but then all of a sudden these other areas become better, you become healthier and things get better. And I'll share with you, and I think I've shared this with you in the past, but 7 years ago, I was experiencing a lot of inflammation in my body, and I was being told to have a sinus surgery. And I really didn't want to have the sinus surgery. Who wants to have another surgery? So I was experiencing a lot of inflammation, though. Some tests and whatnot made me realize that, or made me aware of that, and decided upon the suggestion of a functional medicine doctor that I have a great relationship with. And she suggested that I, based on the results, would cut out gluten and dairy, right? And so I cut out, and she said, listen, Jason, I don't want this to be like one of these things. Like sometimes she'll be like, all right, 90 days, we're not going to consume any alcohol. I need 365 days. I need a 1-year commitment from you, and let's measure the results that you experience. It's going to be hard, but I'm going to help you do it. So we did it. And she said, after a year, we'll reassess and you can decide if you want to add it back in. And I'm like, man, really? I'm like, I love bread and cheese. I'm like, this is going to be super hard. But I did it. And a year later, I wasn't by any means like obese, but I was a little bit overweight, a little bit of a belly and this, that, and the other. And I lost 30 pounds over the course of that year. Wasn't what I was trying to do, trying to clear up my allergies to not have a sinus surgery. At the end of the year, I was sleeping through the night, and I wasn't doing it before because I was having a lot of aches and pains, lower back, my right ankle from a basketball injury. And those things, I would wake up in the morning with them aching. I would wake up at night turning with a little bit of pains, completely went away. It was unbelievable. And so after a year, I'm like, okay, do I want to add 30 more pounds back on and have all these aches and pains and not sleep through the night? No. So I decided to stay on that journey of avoiding gluten and dairy. But great example, it made me think of it, of you don't realize that's what's going to happen when I was trying to address sinuses, but yet I had these other positive effects.
It's so true. And our healthcare system has primary care, which, as I'm also a primary care physician, it's a critical piece, a point person. And we have specialty care. And then within specialty, of course, all the different surgical specialties, medical subspecialties. And these all play a critical role. If, God forbid, family member develops a rare cancer at Cleveland Clinic, we have a person who's an expert in that cancer. And we can go down the line, a rare cardiac syndrome and so forth. So this is essential to have, and so proud of Cleveland Clinic. It's really on the cutting edge of all of that. However, at the primary care level and preventive level, I see a patient, they're overweight, they have some high blood pressure, they're borderline diabetes, they're down, mildly depressed, for example, sleep apnea, their joints hurt and so forth. We have a couple different approaches we can use for that. We can take each one of those things that I just mentioned and make a recommended medication for it. Very reasonable approach. Or we can step back and maybe if the blood pressure's super high, we may want to get that medication going, but we can step back and say, can we lose weight? Do a diet like you're suggesting? Can we develop some physical activity? What's driving the weight? I stay up really late at night, I watch binge on shows and I eat carbs and so forth. Maybe that's not a great thing to do. Let's get an earlier bedtime. Maybe I'm stressed out at work and I'm eating out of stress. How can we work with your stress management? And so those approaches, and even going a step further, I have inflammation and joint pain. Maybe the acupuncturist can work with the patient. All those changes and approaches, they don't just focus on the biological piece. They focus on all the different systems. And so what's exciting is you see improvement in all those areas and all those diagnoses. So it really is stepping back and treating that whole person. And really, that's a major effort of our department to not only do that with our patients, but also to promote and educate clinicians, patients, healthcare providers of the roles of these very important lifestyle changes and evidence-based therapies.
Yep. Makes total sense. And I remember many years ago, the first time I saw Cleveland Clinic brought on a chiropractor. And I think he was like the first one. I don't recall his name, but I was just like, wow, like really blown away that they were going that direction of it's almost like the melding of Eastern and Western medicine, because traditionally and unfortunately, there's still a lot of physicians out there that it's just immediately to prescribing a drug, immediately to a surgery or a topical cream or whatever it might be, but it's not going to the root cause. And that's the difference, I think, in the wellness kind of umbrella of.
And which are ineffective or unsafe too. And 23 years ago, I started a research fellowship. I was mid-career, and Harvard Medical School was offering this fellowship to take physicians and train them how to study these alternative therapies, but in a really rigorous scientific way. And to be honest, I was excited about the fellowship. I didn't see myself as a researcher, so forth. But over the course of the 3 years, I drank the Kool-Aid per se, that studying these things is fascinating, is important. And so me and hundreds of others have been growing research in all these areas. And now some of these therapies are more accepted, which is really great. We're not suggesting they're superior to any other therapy, but they're options for patients that are there. And that's what we're trying to do here at the clinic.
At the end of the day, the patient is their own best doctor, right? You know your
100%.
body, you know your mind better than anybody else. And what you're describing is integrating, right? And that hence the integrative medicine, integrating other approaches versus just kind of being like cattle showing up and getting your shot in the butt. I don't know. You're versus just whatever the doctor says, here's your prescription, not saying don't listen to your doctor, but you do know yourself, and there are other ways. And that's why I wanted to have you on here today.
Thank you, Jason. And I just want to speak on behalf of my physician colleagues. There are a lot of, I think, factors and forces well above the physician that are driving some of the things you're describing. Sadly, the way healthcare is set up and reimbursed and paid for, it's more about the number of patients you see rather than the quality of the connections. And I'm not talking about Cleveland Clinic, I'm talking about the entire United States.
Yes.
And there's economic forces then making the appointments with patients shorter and shorter.
Yep.
And there are many well-meaning, intelligent, educated doctors who only have 15 minutes with a patient with all these other conditions like we're talking about. And the most they can do is to write a prescription. And I don't think there's malevolent forces going on, but it's a challenging time now. And we're trying to make our small effort here in trying to move the needle towards a more whole person type holistic approach.
Because everything is connected. You go to your eye doctor, they'll tell you there can be things that can happen with your vision that are directly related to your heart.
Your example about how the eye is impacted by cardiovascular disease is really an important one. And it's one that I often use with patients because, Jason, you're a highly motivated, educated, intelligent patient. And for someone like yourself, really all I need to do is give the information and direction and you run with it. But many others need to be persuaded. They need to understand what's in it for me. Why should I make these kind of changes? And so what I'll often do then is ask questions. When you retire, would you like to have good vision so you can take walks? Oh, of course I do. Would you like to travel and take some flights and visit your grandkids? Of course I do. To do those things, taking care of diet, your cardiovascular health, making sure you're not too heavy to strain your joints, keeping physically active so the joints are lubricated. These are the kind of things you need to do. So So we talked in the beginning about purpose and meaning. So helping people link their goals and purpose with what they have to start doing today.
Yeah. And the reason I bring that up, as I said at the beginning, one of the reasons that I'm so happy with you as my physician and working with you is because you are looking at all those different areas. I have some science stuff, some art stuff. You're looking at all those areas and how they all affect each other, and it's looking at it holistically. And ironically, I think what we do in the financial world, we call it holistic wealth management. And it's very comparable to what you're doing in the department you're heading up at the clinic, because the importance in my world of the coordination of your investments, your insurance, your taxes, your estate planning, and all your legal documents, and all of that, all being coordinated. Ultra high net worth people have gotten this for decades through family offices, right? And so the CPA, the attorney, the investment guy, the insurance guy, they're all coordinating on behalf of the client. And that family office is bringing it all together. But unless you're worth $50, $100 million, you're not usually getting that type of approach. And so that's what we do. We coordinate and tie all these things together for those people that aren't quite at those levels, right? They're very successful. They've accumulated money. They're hardworking people that have done really well for themselves, but they don't quite have access to that level of, that's what we do. But that's why we call it holistic wealth management, because it all has to be looked at and coordinated together.
I started speaking about terminology and words matter. I think holistic is a wonderful term. It comes from the Greek holos, which describes the whole, and really captures, I think, the essence of what you're trying to do, and in many ways what I'm trying to do. I think for complex set of reasons, holistic health in the 60s and 70s were associated with some of the more fringe practices in healthcare, and therefore maybe got a bad name or reputation. But nonetheless, the principles of truly looking at the person, the family, from all these different directions and considering that whole is so critical. And in fact, interestingly, the Veterans Administration, VA Healthcare, has launched a campaign called Whole Health Campaign, where they're trying to bring this into the healthcare for veterans, and some of the National Institute of Health groups are looking at this. And I really welcome that. As for our veterans, their health struggles are particularly exacerbated by experiences they've had while deployed, while in service, and so forth. So again, this type of holistic or whole health approach can apply for so many people who are struggling and suffering.
Dr. Saper, as you were saying, that made me think of going back to the 60s and 70s, right? When you're talking about people looking at those practices and not understanding it. For the most part, a lot of things that were different, and it's still this way today in many cases, people, when they don't understand something, they think it's weird and different. And there was a lot of Eastern medicine, right? Acupuncture and yoga and meditation. And heck, I even remember watching Karate Kid when I was a kid, and Mr. Miyagi sitting there meditating, and everybody thought it was weird. What's that guy doing? And then he's trying to catch flies with the chopsticks. But no, meditation was not understood or embraced. Neither was yoga. And now look where it's at today. You forwarded me the article on yoga, which I thought was awesome, that you were in Washington Post. And then what was the other outlet that picked it up?
It's got a lot of press, NPR, UPI, Health Day.
And just even this week, and I read through that, and I did not realize that they had a statistic in there, 80% of Americans suffer from lower back pain.
At some point in their life, it's common. I'm sure many of your listeners are shaking their heads right now. It's really true. I'm a primary care family doctor, practicing 32 years. It is one of the most common physical complaints that someone will bring in. And thankfully, for the majority of people, it comes and it goes. It's 3 days, it's a week, and so forth. But up to maybe 20% of folks will develop ongoing or recurring back pain that can really impact someone's functioning.
Right. And yeah, I thought the study was so interesting just about how much it reduced even the people that started doing yoga. And it was virtual yoga too, because I think that's so many people are intimidated. A lot of people know I do yoga. I've been practicing for going on 10 years. And they ask me, and many very successful CEOs of big companies here in Cleveland, and they'll ask me, like, oh, how did you get into it? What was your first class? Where did you go to? And they're a little intimidated with going into a live class. And I do think that's the great thing that came out of the pandemic is the virtual world and how much more embraced it is and the opportunities. I started doing yoga virtually during the pandemic for the first time ever. And I go into this app called Flexit, or you can do it on your computer, and you can do one-on-one yoga sessions. And you pick your instructor, and then they take you through one-on-one yoga sessions. My wife and I have done this. My wife follows a woman, Adrienne, and
Oh,
there's
yes.
yoga by Adrienne. You know who she is?
My adult daughters had to educate me about yoga with Adrienne because I'm not as savvy online and on the social media, but yeah.
Yeah, and she's awesome. And every year she kicks off January with a 30-day yoga challenge. So my wife and I have done that a couple of years where we'll do it for 30 days of yoga. But yeah, it was really eye-opening though, just reading through what you sent over to me, that study, and how many people were able to even go off of medication just by doing very minimal amount of yoga too. It wasn't like they were doing it a ton.
I really appreciate what you said about the 60s and the 70s, and it felt weird and people not comfortable, of course, with something that's different. And that is indeed what the status of mainstream medicine and so-called alternative medicine at the time. But we have come a long way, Jason. I would say in my experience at Cleveland Clinic, and prior to that, I was at Boston Medical Center, were there skeptics? Sure. Curious skeptics asking questions or maybe feeling neutral about it. But in the 70s and 80s, there was overt antagonism to it. So like right now, benign neutrality is the worst case scenario. And then best on the other end of the spectrum, there are medical students and physicians who are now like trained yoga teachers, and there are collaborators in research. I would have never been able to predict that 20, 25 years ago. And yoga is really interesting. So I started yoga when I was in medical school in the 1980s and really was struck by how positively it impacted me. It was a difficult time. It was very stressful. I was really questioning, should I be in medicine? Am I in the right place? And yoga was one of the sort of things that helped me get through medical school. And then I remember even as a resident on call every 3 days, 3 nights, 4 nights, caring for really sick patients. I was a resident at San Francisco General Hospital, and that was really the epicenter on the West Coast of the AIDS epidemic in the late 80s and early 90s. And here I was, 25 or 26 years old, and I was caring for 25 and 26-year-old men who were dying that we couldn't do anything about. And so very emotional, challenging time, and yoga helped get me through that. And then dial ahead about 10 years, I started this research fellowship, which I mentioned, and I had to pick a research topic. So I said, pick yoga. It wasn't really studied much. I was interested in it. It had started to develop an interest. And my first paper looked at the use of yoga in the United States for 1998. And we showed that 3.8% of adults had used yoga at least once in the previous year. 2022 data, I think the stat is, don't quote me, 14, 15%.
Wow.
Of adults. The growth of yoga, I think all of your listeners will agree. You see it on the corner, you see it in the checkout aisle. And so there's been this tremendous growth. And paralleling that growth has been research. And so in my particular situation, the study that we just published in JAMA Network Open, looking at virtual live stream yoga for chronic low back pain, is our 5th randomized controlled trial of yoga for back pain. And like you said, pre-pandemic, I just would have never imagined or thought of some kind of virtual yoga class and study. But obviously, we all had to pivot. And so we pivoted in research. And to show that these live stream yoga classes had the very similar impact that the in-person classes had that we ran in published in 2009 and 2007, 2013, 2017, other studies, was really, really exciting to see. I do think my goal is to try to identify these scientifically based approaches that can be helpful and integrate them into healthcare. I think work like that paper is moving yoga in this direction. Now, that just happens to be a personal and scientific interest. There's many other approaches we're working on here, but I think it's a nice example of this growing awareness, growing research that will lead more to integration into healthcare.
What a fun conversation. We touched on a lot of things today, but I there's no doubt that the listeners were able to get a lot of clarity on a lot of this terminology and kind of where things come from and things they can consider to focus on their own, not just holistic wealth, but holistic health.
Love that. Jason, I want to thank you. It really has been a great conversation. Really appreciate it, and wishing you well and wishing all your listeners well.
Thank you for listening to the Holistic Wealth and Health Podcast. We hope we inspired you to make changes so you can live your best life. If you want to find out more about what we do, or if you want to have a holistic wealth and health financial plan, please call 456-833-7000. Please subscribe to the podcast and share it widely with your friends and family. Financial planning and advisory services are offered through Prosperity Capital Advisors, PCA, an SEC-registered investment advisor with its principal place of business in the state of Ohio. J.L. Smith Holistic Wealth Management and PCA are separate, non-affiliated entities. PCA does not provide tax or legal advice. Insurance and tax services offered through J.L. Smith Holistic Wealth Management are not affiliated with PCA. Information received from this podcast should not be viewed as individual investment advice. Product discussions and illustrations are hypothetical in nature and will vary based on many factors, including, but not limited to, age, health, product, insurance carrier, and product design. You should consult the insurance carrier website and policy for detailed information. For information pertaining to the registration status of PCA, please contact the firm or refer to the investment advisor public disclosure website, www.advisorinfo.sec.gov. For additional information about PCA, including fees and services, send for our disclosure statement as set forth on Form ADV from PCA using the contact information herein. Please read the disclosure statement carefully before you invest or send money.